Hello and welcome to the 2020 Influenza Update. Firstly, we would like to acknowledge the traditional custodians of the land on which this event is taking place today. We pay our respects to elders, both past, present and emerging. My name is Angelina Boswell and this is Gabrielle McGuigan. We're the public health nurses that work for the immunisation programme. In our team, we have Romany Balodis, Nancy Goncalves, Nicole Gordon-Cook, Lisa Luxford and Kathy Lort-Phillips. And we're all work at the Tropical Public Health Unit in Cairns. So we're welcoming you to a very different influenza update this year. We're not at the Cairns Auditorium, unfortunately, so we don't get to meet you all this time. This is due to the COVID-19 response and the social distancing measures. This education session will only be available on the Primary Health Network website. So we're going to be emailing you the details of how you obtain this. And for CPD and credentialing requirements, we're going to talk a little bit at the end of how you can access how you get your certificate and how we can see who has listened to the presentation. And questions, we'll talk about that at the end. So, due to the COVID-19 response, Tropical Public Health Services in Cairns is currently in business continuity mode. So most of our staff are working with COVID-19, including ourselves, and we're dealing with positive cases and contact tracing. So business continuity means there are certain things that we still have to keep going, even in the event of this pandemic. So for us, with immunisations, it's cold chain breaches and adverse events following immunisation. These are our main activities that we have to continue doing. So we do have limited capacity to respond to your routine immunisation queries. So the best way to do this is for you to email our joint email address. It's better than emailing us individually because obviously we have days off and we're also acting in different roles at the moment. So the email address, it's tphs_cdc_ims@health.qld.gov.au. We all check this email address, so you're more likely to get a response quicker by emailing us. Okay, so we'll just go through the objectives of today's presentation. So firstly, we'll be looking at the current situation with influenza and COVID-19. Then a look at the 2019 influenza season. We've just got a couple of slides of the figures from that. And then we'll go on to talk about 2020 influenza and what's available this year. And also we'll look at who's eligible, the at-risk groups, the rollout dates for the 2020 influenza programme. And then we'll just have a quick look at AIR, and I'll be showing you some of the resources that are available this year. And Gabrielle is going to have a talk about cold chain. And then at the end, we'll talk about how you can ask your questions and how you're going to be able to obtain your certificates. Okay, so protecting our community. Influenza vaccination, it's a priority this year more than ever due to COVID-19. And annual vaccination is the most important measure to prevent influenza and its complications. COVID-19 is causing a great deal of distress and concern in our community for both healthcare providers and the general public. Contracting influenza and COVID-19, it has been described in the media as the perfect storm. So influenza vaccination reduces the risk of two potentially serious infections, which is influenza and COVID-19 occurring simultaneously. This is something that we really want to avoid, especially for our vulnerable people in the community who are most at risk of contracting both. So we need to be able to roll out this programme as quickly, efficiently and as safely as possible, as the influenza season adds additional pressure into our health system, and our health system is already under strain at the moment. We want to try and avoid hospital admissions. And vaccination, as I said earlier, it continues to be the best measure in preventing influenza. And the more people vaccinated will create a greater protection in the community, and we'll be obtaining herd protection. With social distancing measures in place, influenza clinics may require adaptations and view to explore current models of care in delivering the programme this year. We've had a look at some suggestions from around the area, and one of the suggestions is schedule your clinics first thing in the morning for well patients and schedule your unwell patients in the afternoon, just to try and split up the wells and unwells. Request your patient to telephone from outside the clinic when they arrive, and you can call them back and actually conduct their pre-immunisation consultation over the telephone. And then when you do see the patient, you're literally just giving them the vaccination and then they're done. You're spending minimal amount of time with patient contact. In some clinics, people are vaccinating in their cars, but if you are doing this, obviously you have to make sure that your patients are waiting the 15 minutes post-vaccination. And some clinics have identified larger locations or a separate room because a lot of places are closed at the moment. We are aware that some clinics have actually obtained an extra room specifically for influenza clinics. And the document in the top corner there is the Interim Infection Prevention and Control Guidelines for Management of COVID-19 in Healthcare Settings, which is this document, and this document will give some really good advice for your infection control measures during the COVID-19 outbreak. And some people have made some really innovative ideas with their clinics this year, and everyone's doing a terrific job. But this document may help with your infection control. So there's lots of resources for COVID-19. The Australian Government Department of Health website is the best website to go to. Below are some of the documents that are available. And also Queensland Health has its own COVID documents also. These are all obtained online. They are changing regularly because COVID-19 is evolving so fast that you just have to make sure that you're looking at the most up-to-date documents. And also the Australian Government COVID-19 app is absolutely brilliant. Anyone who's a positive case or anyone who's ringing up for advice, we're referring everybody to this app. It has all the most up-to-date information that you need. It has a big list of advice, all the news and media. It's got a symptom checker, and it's up to date, and it's what we're using. Everybody's using that, so I would recommend having that app. And refer your patients to have the app as well. Recommend that they have the app. This is just a couple of posters that are out there at the moment, and it's just to show you how similar the symptoms are between COVID-19, a cold, and influenza. So you can see it's very, very similar symptoms there, and it's a handy little poster to have. These are available in Department of Health as well. All right, so the 2020 influenza programme. Should be out. The vaccine should be out in most people's fridges already. The first rollout happened over a week ago, so you should have those vaccines already. I'd just like to show a message from Jeanette Young, our Chief Medical Officer. She did a recent media release, and that was promoting the influenza vaccine. So we'll just show you that clip now.
One of the reasons you can leave your own home is to get medical care. And getting a flu vaccine is medical care, and it's more important than ever that people do that.
Okay, so we'll just go back and have a look at the 2019 influenza season. This graph here, it's the weekly notifications of laboratory confirmed influenza for Cairns HHS, and it spans from the 1st of January 2014 up until the 27th of October 2019. We don't have the end of the year data at the moment. We've just had our epidemiologists are just busy with COVID-19 at the moment, and I couldn't obtain the full years of data. But looking at this graph, you can see quite obviously in red is 2019, and the peak in March and April really stands out there. It's a huge peak, and it's larger than we'd had in previous years up until 2014 at least, what you can see. Previously, the highest peak before that was in 2017, and you'll note that that's later in the year that occurred. And with our large peak that we had in March and April last year, you can see that there's a second peak in August and September. And we do often experience that with the tropical climates, and it just makes it all the more important that our over 65 age group are getting the Fluad quads, because that's the highly adjuvanted vaccine, which is going to last longer, and it will get our aged care members of the public that extra protection during the second peak of flu. The next slide is the year-to-date notifications of laboratory-confirmed influenza by 5-year age group and sex. And again, that is just last year, but it only goes up to the 27th of October 2019. And what stands out quite a bit in this group is that the age group from 5 years to 14 years is quite high. And this age group aren't actually part of the funded vaccines with our NIP schedule. So again, it raises the importance of offering private vaccine to this age group. Just because people don't fit into the categories where they're eligible for government funded, there are still high rates of influenza for people in between those age groups. These are just laboratory notified cases, but there are other cases obviously that people have that we don't know about. And it doesn't show hospitalisations or deaths. So it would have been great to have had access to that data, but I'm afraid I didn't have that for this presentation. Okay, so I don't know if anyone has seen the NCRS webinar. We did publicise that, so hopefully people did see this webinar. It's you can just click on the link, it's still available, and the NCRS are our experts in immunisations. We refer to all their fact sheets for information, and this is a half-an-hour presentation, and the first presenter talks about the influenza virus itself, how vaccines are made, and they go into quite a bit of detail about the influenza season last year. And then the second part of the presentation talks about this year's flu programme and eligibility. So it's a half-hour presentation, and I would recommend clicking on that for more in-depth information on the influenza vaccines. So influenza in Australia, on average each year influenza case causes 3,500 deaths, 18,000 hospitalisations and 300,000 GP consultations. So that's a huge strain on our health service. And children under 5 years and adults over 65 years, they have the highest rates of hospitalisation. And this is the age group that's eligible for the vaccine, so we really want to push their vaccines. The 2020 Queensland Health influenza vaccines. So this year, all our vaccines on the Queensland Health immunisation influenza season, they're all quadrivalent, which is great because last year we had the Fluad, which was a trivalent, and it only had one of the B vaccines, and a lot of people over 65 were requesting to have a trivalent, the quadrivalent vaccine to make up for the missing B vaccine. So this year it's just easier that everyone gets 2 A's and 2 B's. So in the vaccine, one of the A components is the H1N1 Brisbane. The other one is the AH3N2 South Australia. And with the Bs, you've got the B Washington and B Phuket. So all the vaccines contain both A's and both B's. This is a little clip from the ATAGI statement. So hopefully everyone has a copy of this. If not, you can just download ATAGI statement Influenza 2020. It gives you all the advice that you need on the influenza vaccines for this year. And you can see here it's got the age groups and who's eligible for which vaccine, and all the vaccines apart from the Influvac Tetra are available with the Queensland Health schedule. So the government funded vaccines that are going to be in your fridge, and hopefully in your fridge already, you've got the Flu Quadri, and that can be given from 6 months old. Vaxigrip Tetra, that can also be given from 6 months old. And your Fluarix Tetra is the third one that can be given from 6 months old. It's the Afluria Quad that they can't be given if they're under 5 years of age. So do be careful with your Afluria Quad. Make sure it's kept separate from your other childhood vaccines so it's not given by accident. And then the Fluad Quad can only be given to people from 65 years of age. So it can't be given to anyone any younger. You should all have these resources in with your orders that came, your flu vaccine orders. If you don't, These are available on the Queensland Health immunisation website. The one in the bottom left-hand corner is the immunisation programme update, which is the newsletter that the immunisation programme produce. And that's got a lot of information on the influenza vaccine and the vaccine programme this year. One of the forms, the second one along, the 2020 Influenza Immunisation Programme one, that tells you the vaccines, who's eligible, and which vaccine you should be given per age group. And so your children under 6 months of age, over 6 months of age to under 5 years of age, you've got your Fluarix Tetra, your Flu Quadri, and your VaxiGrip. And then for everybody else from 5 to 64, they can have a Fluaria Quad, Fluarix Tetra, Flu Quadri, and VaxiGrip Tetra. And then it's just going to be your Fluad Quad for your over 65 years of age. And this is the best vaccine. They should all be in your fridge. There should be no reason not to vaccinate them with Fluad Quad at this moment in time. So we'll just talk a little about the children and their eligibility. So children under 6 months of age are not vaccinated with a seasonal influenza vaccine. If the mother's been vaccinated during pregnancy, the infant will have protection, and they'll get that protection via transplacental protection. All children over 6 months of age and less than 5 years of age are eligible, and they should be offered the 2020 influenza vaccine. And this can be safely given with all their other routine national immunisation programme vaccines. So it won't hurt them to have one more needle, and you should be recommending it and discussing the influenza vaccine this year more than ever. And then children over 6 months of age and less than 9 years do require 2 doses of influenza vaccine in the first year. That has to be given at least 4 weeks apart. It doesn't matter if it's longer than 4 weeks, but you have to have a minimum of 4 weeks. And that's in the first year that they receive the vaccine. 1 annual dose of influenza vaccine is required in the following years, even if one was only given in the previous year. So if they don't get 2 vaccines in that first year, you don't then go and give 2 vaccines the following year. It's always just annually after that. Pregnancy. So pregnant women are eligible at any stage of their pregnancy. So all vaccines in Australia are inactivated vaccines, and they can be given safely to pregnant women during any stage. Also, influenza vaccine, it can be safely given to women at the same time as their Boostrix vaccine, so their DTP. So DTP can't be given until 20 weeks gestation. So if they're past 20 weeks gestation, they're due their Boostrix and they're due their influenza, they're fine to have both the vaccines at the same time. So for pregnant women who received an influenza vaccine in 2019, you do need to revaccinate them with the 2020 influenza vaccine before the end of the pregnancy. So as we said earlier, if they're vaccinated before the end of the pregnancy with the current seasonal vaccine, they are going to pass on their antibodies to their unborn child, because that baby can't be vaccinated until 6 months of age. So the baby will get protection as a newborn from influenza. For women who receive an influenza vaccine before becoming pregnant, you can revaccinate them during pregnancy to get that additional protection. So if it hadn't been given in pregnancy, the evidence does show that a vaccination given to a lactating mother is safe and can provide protection. So breastfeeding mum is going to pass on her antibodies to her baby. If neither of them, obviously the baby won't have been vaccinated, and if the mother hadn't have been vaccinated during pregnancy but ends up getting a vaccine during lactation, there will be some benefit from that. So our Aboriginal and Torres Strait Islander people, this is from 6 months of age. So Indigenous populations do experience a higher rate of disease and a greater burden of illness. So all Aboriginal and Torres Strait Islander people are eligible to receive age-appropriate funded vaccines, and Aboriginal and Torres Strait Islander people over the age of 65 are recommended to receive the adjuvanted Fluad Quad. And then your Aboriginal and Torres Strait Islander children under 5 years of age should receive the recommended childhood vaccine. So we are concerned about our Indigenous population because of COVID-19. There is a greater risk of COVID-19 causing serious illness in individuals living in communities with chronic disease, such as remote Indigenous areas, and all the more reason to get them vaccinated with their flu vaccine. And the website that I've included at the bottom is the indigenous.gov.au, and it's got an interesting website on promoting Indigenous health, if you want to have a read. So our adults over 65 years and older. This is our vulnerable population that we really want to ensure are well and truly vaccinated. So this year, the over 65 vaccine is a quadrivalent vaccine named Fluad Quad. So it contains the 2 A's and the 2 B's, the same as everybody else is getting. And all adults aged over 65 years are recommended to receive the Fluad Quad. You should have these vaccines in your fridge now because the vaccine programme has already rolled these out, and ideally this is the only influenza vaccine that we would want you to be giving the over 65s. So that is because the Fluad Quad is specifically designed to increase the immune system's response to the vaccine, and the increased adjuvant content results in this response. So they're getting a lot better immune response. Because they have a lower immune system, it's been made to be adjuvanted to improve that immune response and keep the protection lasting for longer. So it is only licensed for people over 65 years of age, so we don't want you giving it to anybody who's under 65. But the only thing is, with the high adjuvant content of the vaccine, there is more risk of injection site reactions. So we did have a few come through last year because of the adjuvanted vaccines. It's usually just a local reaction on the arm, some swelling, or possibly a sore arm. But obviously anything that seems out of the ordinary, just complete an adverse event form, and we'll look into that. And just the Zostavax and Pneumovax, they can be safely given at the same time as the influenza vaccine. But often this is when you get your older clients come to the doctors, so it's a good time to check whether they're eligible for the Zostavax, which is from 70 years, and the Pneumovax from 65 with our non-Indigenous and Indigenous age 50. Our clients that have medical conditions. So people aged 6 months and older with medical conditions, but putting them at increased risk of severe influenza and its complications, are eligible to receive an age-appropriate funded influenza. The list of categories that people can fall into is found on the Australian Immunisation Handbook, and this is the ATAGI statement that I talked about earlier. So on the back page of the ATAGI statement, it lists these categories, and we've got cardiac disease, chronic respiratory conditions, chronic neurological conditions, diabetes and other metabolic disorders, renal disease, hematological disorders, and long-term aspirin therapy in children aged 6 months to 10 years. So you may need to have to discuss with your patients and possibly with the GP as to which category your patients might fall into. But anyone who's in these categories, offer them influenza vaccine. So just some additional vaccine information. The dose of influenza vaccine for all ages this year is a 0.5 ml dose. So there is no 0.25 dose for young children, which there has been previously. So no matter what age, from 6 months up, it's a 0.5 ml dose, which does make it easier. And then people with egg allergies can safely receive the Australian influenza vaccines that are available in 2020, and influenza vaccines used in Australia in 2020 are latex free. And this information is all on those NCRS fact sheets as well. And then I've talked about private vaccination earlier. So for people who aren't eligible for the funded influenza vaccine, private purchase is available and it should be encouraged. You may get more people asking for private this year because of the risks of COVID-19 and not wanting to have flu and COVID. But make sure you mention that if someone's not eligible, we do want to make sure that they're aware that they can purchase privately as well. This is a new document that came out recently. It's the aged care document for coronavirus for the coronavirus, but it does mention that from the 1st of May, you must have your influenza vaccine to work or visit an aged care facility. So I just pop that in there just to make sure that everybody is aware. And obviously, if you've got any aged care workers coming into your practice, promote the influenza vaccine for them. Vaccine delivery. So there are 2 rollouts. The first commenced on the 23rd of March. That's why I'm saying by now you should already have the vaccines in your fridge. The second will commence early April, and we are hearing now that people are getting that second round. So they're not just getting the Fluad quads, they're getting all the other quadrivalent vaccines for the other eligible age groups. And then weekly orders commence from Tuesday the 14th of April. So every week it runs up until towards the end of May. You can do your weekly orders and keep that stock rolling. You should be aware that from Monday the 30th of March, the immunisation programme implemented an email-only vaccine ordering and inquiry arrangement. So we'll have a talk about that a little bit later. We have had wind that there is a shortage of Pneumovax 23. I haven't heard of any providers actually telling us that their fridges are in short supply with Pneumovax 23, but we've been told via Brisbane Immunisation Programme that there currently is a shortage. So you may start to see your supplies dwindle with that, and we haven't been given an end date or don't know anything further at the moment other than that there is a shortage. The AIR register. So please ensure that all influenza vaccines administered go onto the AIR register. And that's not just your government funded vaccines. Any private vaccines given, they also need to go on the AIR register. So hopefully all your software is automated for everything to go through onto AIR, but if not, you'll have to do direct entry yourselves. And then the newsletter from the immunisation programme that I talked about earlier, has got a little section that says what's new for AIR. And it says now that health professionals with a Medicare provider number can now delegate their AIR access to another person. For example, a practice manager or a practice nurse. And they also said that if a provider records on AIR that a child is on a planned catch-up, this is now going to appear on the AIR history statement, which is great for children on a catch-up schedule. We can see that they've got their schedule up and running. And this information is available on that newsletter that I just told you about, and that's the little link to get onto that newsletter. So resources, there are lots of resources for the influenza programme. That's the ATAGI statement on the left, and that pretty much tells you everything about eligibility on there. And it talks about your medically at risk on the back page. So you can just download that, or these NCRS influenza, one's a frequently asked questions and the other one's a fact sheet. And the frequently asked questions has been updated since the one a few weeks ago because they've now added information on COVID-19. So if you printed one off a couple of weeks ago, just have a look because it has recently been updated. I think that might have only been last week. And they're great to go through with clients if they've got questions or for answers that you don't know yourself. In the top right-hand corner is the immunisation programme newsletter, which is always handy at this time of year because it tells you a lot more about the influenza programme when it's been rolled out. And then in the bottom left, we've got the Australian immunisation handbook. Everyone should be using the online version now. I know a few people still refer to the book, but everything online is the most up-to-date, and the more you use it, the more you'll learn to navigate it. Well, that completes the Influenza 2020 updates, and I'll pass you over to Gabrielle to talk about cold chain now.
Hey everyone, I'm now going to update you on cold chain and changes to the immunisation program. As at the 30th of March, we now have a different procedure for notifying your cold chain breaches. We are now going to be reporting cold chain breaches via email. So in the event of the cold chain breach, as per normal, you'll be isolating your affected vaccines, but you'll complete a cold chain breach form and email it to the email address that is on your screen. Please mark the email in the subject line with cold chain breach, so that will notify the people at the immunisation program unit that that is what is coming. and send that email through to the immunisation program as soon as you can. This is the form that you will be sending through. It's a new form and it is accessible on your database. So just go into the immunisation program unit and you can download that. Keep it on your desktop so it's at hand, and that is the form that you will be emailing through when you have a cold chain breach. These are just some email addresses that you will be requiring when you are dealing with vaccines. So we have an email address for your vaccine orders, for your cold chain breaches, vaccine discards, your influenza discard and your transfer, your vaccine delivery failures, and also a website address there for all the documents that you will need in relation to vaccinations. With the heightened importance of the 2020 influenza program due to the COVID outbreak, we can't risk the influenza vaccines being lost due to poor cold chain practices. All practices should now have an up-to-date VMP, which is referenced to the current Strive for 5 3rd edition. So that is your vaccine management protocol. The Strive for 5 3rd edition should be in every vaccine service provider's facility and be readily available. Any member of staff involved in vaccine management must have had cold chain vaccine management education within the 12 months. And can I just suggest that the VMP can be laminated and attached to the fridge and become a very everyday document for all staff to be accessing in the event of a cold chain breach. Ensure that all staff are aware of what to do in the event of a cold chain breach and how to prevent one from occurring in the first place. The immunisation program and TPHS Cairns recommend that anyone involved in vaccine management should complete the online e-learning vaccine management course too, and this can be added to your CPD hours. The website address for that is just at the bottom of your screen now. That module is also can be indicative for whichever staff member, whether it's admin, nurses or doctors. You can choose your line and it'll be applicable to you. Your stock is going to increase greatly, as it probably already has. So just make sure that you have enough storage space so that your vaccines are stored correctly in your fridge. They aren't up against the back or the sides, and there's enough airspace around them. Do you have a backup power supply? Has it been serviced and checked recently? Where is your alternative storage stored? Eskies, bubble wrap, ice bricks and thermometers should be at the ready and should be, all staff should be aware of where they are stored in the event of a cold chain breach. Have your battery operated thermometers had a battery change and slush test within the 12 months? Refer to page 27 of the Strive for 5 3rd edition for instructions on how to complete your slush tests. In the event of a cold chain breach, initially you need to isolate your vaccines. Investigate the cause and rectify if possible. Email the cold chain breach form, the one we showed you before, through to the email address on your screen. Vaccines are to remain in your fridge, in your purpose-built vaccination fridge, while the temperature remains between 2 and 8. If the temperature goes out of 2 to 8, the vaccines are not to be removed until your eskies are fully prepared. That includes conditioned ice bricks, adequate packing material, and thermometers to monitor the minimum and maximum temperatures of the vaccines. The minimum maximum temperatures should be completed and documented every 15 minutes for the first 2 hours and then hourly. So we want a minimum maximum there, not a current temperature, so that we can see what is happening with those vaccines. And also, please document a timeline of events and all temperature monitoring so that we can refer back to what is going on with the vaccines at that time. Cold chain and protecting our community. Ensure that your vaccine management protocol has strict protocols in place to refer to in the event of a cold chain breach. The Strive for 5 3rd edition contains all the information required for packing and monitoring an esky. We want to ensure that our community is receiving potent, viable vaccinations to reduce the burden on our already strained health system and keep the people in our community healthy and safe from vaccine-preventable diseases.
Okay, so obtaining certificates is going to be a little bit tricky this year because we don't have our attendance sign-in sheets that we normally have when we hold the event at Cairns Auditorium. So we are trying something a little bit new this year. It's called Eventbrite, and you need to log on to Eventbrite, and the login details are here. And if you click on this and purchase a ticket, which is a free ticket, you just click to say that for the event, and then your name automatically goes into an attendance list. You don't need to do anything else. We can go into our page and we can look and see who's clicked on, purchased one of our free tickets. We'll look at the attendance list, and then your details should have been added into there, and we'll email you a copy of a certificate from TPHS. If there are any issues with this, please contact us on our TPHU CDC IMS email address. It is new, it's a different way of doing it. We're having to alter things a little bit because of COVID-19, so it may have a few teething problems, and if it does, please let us know and we'll ensure that you do get a certificate. But this just gives us a good register of who's listened to this event and gone in and purchased a free ticket and with an attendance list. It's the best way we can do it at the moment.
Thank you very much, everyone. That's our 2020 influenza update for this year. If you have any questions at all, please feel free to email us, and we look forward to seeing you all next year, where hopefully we can enjoy some catering together. Stay well and stay safe. Thank you.